that I can take everything you just said to the bank. So thank you, Sharon, and thank you for being really the warrior that you obviously are. All of us really have to turn into warriors when we're faced with the diagnosis that we both had. Next, I want to introduce Steve Wasala, who is he's the CEO of Children's Cancer Cause. This legislation also importantly includes several provisions that target adolescent and childhood cancer. There are many. Unfortunately, when you're a child and you're diagnosed with cancer, we have a much higher rate of survival nowadays. But these are young people, as I was when I was 41 and diagnosed with breast cancer, that live many years, most of their lives as survivors. And there are ramifications and issues that they have to address for far longer than people who are older when they're diagnosed with cancer. So Steve, thank you so much.
Thank you, Congresswoman. It's really an honor to be here with all of my colleagues from the cancer community, and thank you for your tireless leadership on this issue. I'm pleased to be here on behalf of Children's Cancer Cause and the pediatric cancer survivor community. Since our founding in 1999, Children's Cancer Cause has worked to improve drug development and to advocate for the needs of survivors for better care and coverage. And our mission really speaks to that. It's a long, healthy life for every child with cancer. Childhood cancer is unfortunately the leading cause of death and disease for children. However, due to advances in treatment today, as the Congresswoman said, there are many childhood cancer survivors, over 500,000, yet they face a life of health challenges as a result of the toxicity of their treatment. I wanted to just mention that pediatric survivors are unequally affected because of the long-term late effects of cancer treatment. And as a result, 95% of the childhood cancer survivors face at least one long-term late effect as a result of their treatment. And over a third of these individuals are going to suffer from severe and chronic health impairments that can include hearing loss, osteoporosis, heart disease, and infertility, again, due to the treatment they received. And unfortunately, many are unaware and unprepared for a long life ahead in facing these challenges. They also face the recurrence of secondary cancers, and as one survivor described it, it's like living with the constant fear that the cancer will return. And despite the increases in survivorship, as the Congresswoman said, the health system is generally unprepared for this special population. Survivors seldom receive explicit guidance or a survivorship care plan. Providers and families are generally not aware about the future needs that will occur. And this can be especially true for childhood cancer survivors who are often too young to remember the specifics when they were treated. So it's really exciting today that this legislation is going to be introduced because, as the Congresswoman said, it really addresses the specialized needs of this population. And I'd just like to mention first that the bill encourages the creation of a Center for Medicare and Medicaid Innovation demonstration program to encourage the development of a standard of care around developing a survivorship care plan and delivering it to patients and families as part of the transition that we talked about earlier. Second, the bill authorizes Medicaid to create a childhood cancer survivorship work group to develop best practices, and it'll be important because these best practices will be disseminated to providers and states. In closing, I just wanted to say that Children's Cancer Cause believes that this legislation will help individuals like Susan, a Hodgkin's lymphoma survivor with heart valve disease and breast cancer as a result of the radiation treatment she received as a child. And we recently did a patient-focused drug development conference, and she said, "The treatments that save my life now seem to be slowly stealing it. On difficult days, I feel that survivorship is a progressive terminal illness." Working with the Congresswoman and the other bill sponsors, we're making an incredible step today towards our population and all survivors in America. So I just wanted to say thank you, and to 290.
I think we're, from now on, we're just gonna, until this bill becomes law, we're gonna be known as Team 290. Thank you very much, Steve. And then last but certainly not least, I'm